Watching this video is vital the first time you use the biband. I'm Dr. Lance Gordon, and I'm the inventor of the biband matrix. I put together this short video to give you some key placement techniques. Now, this is not your traditional sectional matrix system, so it's very important you watch this before using the biband. Here's everything you'll need to get started. The biband matrix kit includes 3 size bibands, small, medium, and large. This is similar to Dentsply's Palodense wedges. Also included is the matrix band detachment instrument and 3 single-use matrix rings. You'll need to take out your typical Garrison sectional or Palodent, whichever you prefer, matrix band removal forceps, as well as your rubber dam clamp or matrix ring forcep. And of course, your typical composite kit. To place the biband, we want to drop in the matrix bands from the occlusal first, and then follow it with the wedge here at this 45-degree angle. A common mistake for dentists is try to place the bands in from the lingual or the buccal like this, and it makes it a lot more difficult for placement. Here is an occlusal view, dropping the bands in from the occlusal and then the wedge, making sure that the arms of the wedge are nice and adapted. This is another common mistake, is that the wedge is not pushed in far enough, leaving this space. We want it nice and snug up against the lingual or the buccal of the teeth. And we want to make sure that this is the direction in which we are removing the attachment of the matrix band from the wedge. So we're taking our instrument and we're pushing towards the tip of the wedge. And we're going to remove one side, and then we're going to come in and remove the other side of the attachment. Also, again, going in this direction of the arrow. We're going to use the instrument to open the matrix band up into this diamond shape. Here's another view of that detachment from one side and then the other. Always try to remove the matrix band from the wedge in this direction, as doing it in the other direction might displace the wedge out of place. And make sure that this matrix band is nice and open. Do not over collapse it, or else we can't place the ring in after. Here we're placing the matrix ring into place. We want to put one side in, then the other. Here's a way that we can adapt the matrix bands a little bit more to the teeth if needed, by pulling on the matrix. And here we put in one side and then the other, using that teetering technique. I've asked many dentists this question, and it seems to be split down the middle. When they're restoring back-to-back fillings, would they prefer to do one tooth at a time or restore multiple at the same time? Now, you can do either or with the biband matrix. So here we are restoring tooth number 3. We're going to remove the matrix band associated with tooth number 3 by detaching it from the wedge arm. And we're going to move that aside, and we're going to move on to tooth number 4. Here we are burnishing to make sure we get a nice and tight contact. What's great about this technique is that you never have to remove the wedge, which is what causes bleeding between the teeth and contaminates the area. So here we are finishing tooth number 4. We're going to remove the matrix ring, and then we're going to remove the matrix band from the other side of the wedge. And we are done. Now, your feedback is greatly appreciated and also critical to help shape the next steps for the biband. I created a clinical trial guide which has 3 things in it. It has the survey, it has the instructions, and it also has a Dropbox link. So on there, after every procedure, I would ask you to do the survey and submit that. Now, we also have optional taking pre, post, and mid-procedure pictures, videos even better, and pre and post x-rays. Well, all of this will help give us more feedback to understand what the biband needs, if anything, and if we're ready to take the next step and launch. Now, don't hesitate to reach out if you have any questions. I'm going to be giving my email address, phone number, text, email me, call me, whatever it is if you have any questions. Thank you so much for your participation in the trial, and I look forward to your feedback.